procedure, it is important that the steps are performed in the order given without interruption. The ALFA-Test must be brought to room temperature in its packaging for at least 30 minutes before use. Disposable gloves and a lab gown should be worn while performing the test. In addition, the cellulose strip in the cassette must not get in contact with the pipette or the allergen bottle. First, the fingertip from which the blood is to be taken is cleaned extensively with an alcohol sponge, then let the fingertip dry for a minute. Next, the lancet device is prepared. To do this, the dark red pin is pressed firmly into the lancet device until it clicks into place. Then the pin is turned clockwise until it loosens and can be pulled out. Now the prepared lancet device with a large round opening is pressed onto the cleaned fingertip and actuated by pressing the trigger firmly. The finger should be held horizontally. Next, the finger is massaged in the direction of the fingertip until a large drop of blood appears. In the next step, the drop of blood is lightly touched with the pipette. The pipette must not be squeezed. If the pipette does not fill automatically up to just before the black mark, allow more blood to flow or use a spare pipette. Next, the whole blood is transferred to the basis set. At this point, plasma or serum can be used instead of whole blood. In order to transfer the blood, the small hole on the pipette must be covered while squeezing the pipette. Immediately after the blood has been transferred to the test strip, 2 drops of the selected allergen solution must be placed on the blood at the sample application site. The test strip must now remain on a flat surface until it is evaluated and may no longer be moved. After an incubation time of 15 to 20 minutes, the test result is visible in the evaluation window. The test result can be read either optically or using an LFA reader to get more detailed information about the test result. If the test result is positive, both the test line T and the control line C can be seen. The color intensity on the test line is proportional to the allergen-specific IgE concentration in the patient sample. If the test result is negative, however, only the control line C can be seen. If neither line or only the test line T is visible, the test result is invalid and must be repeated with a new basis set. Learn more about the ALFA-Test at foca-labs.de. We diagnose future. We are Dr. Foca.